not in attacking people, but in demanding for everybody to have access to the best tools, a unified TB community, because sometimes it's not just for TB, it's the same in HIV and malaria. Initially, I thought that it's just in TB that there are nye. No, it's everywhere. The older I get, it's everywhere. But we need in TB to stay united. Let's don't kill ourselves there. So it's with Global Fund, with WHO, with the donors, with the private sector, with the technical partners, with the civil society. Now we need to be united. So I want a united front. And the third is this. We want a very strong political declaration with very clear targets. But to happen that, we need to have two very strong co-facilitators. Yesterday, in the plenary of Global Fund Replenishment, the Indonesia Minister of Health said, we want to be one of the co-facilitators. And Indonesia is an amazing country. So I think if they are one of the two co-facilitators, let's see if there are other countries interested or how it goes, because it's not a decision taken by the replenishment. But we need also the meeting to happen in September 2023. There are some pushes that maybe it's happening in June. We should never, some of you, if you meet anyone and somebody says June 2023 for TB, you literally say, or maybe you physically attack them, you say that's not an option for us, because we need to have the visibility with the heads of states, and in June we will not have that. A part of this, the only last point that I want to make is that what worked very well for the previous declaration, because it worked, is that we had numeric targets. We were not speaking butterflies. You know, you can have these UN documents that are like 60 pages in which you don't understand anything. It was very concrete. Said, find 40 million people and put them on treatment. And then we unpacked that per country, and we said, this is the share, I'm Romanian, of Romania. So if you want 40 million to do, Romania, you need to find your share. 10,000 people. Yeah. How far are you or how close? So that's my dream for the UNHLM. And I think because I get old, but I'm so happy that I never met Jackie. We have so much energy. I think that's what we should aim for in 2023 and nothing less.
Great. Well, thank you, Dr. Ditiu. Thank you, Jackie. And we will dig into this more in the rest of the program. Thank you.
Of a country-specific view of the fight against TB, I want to welcome up our next two panelists to the stage, please. It should be working. So today we have Dr. Joe Fala, who's the Minister of Health for South Africa, and we have Dr. Leah Tadesse, who is the Minister of Health for Ethiopia. So thank you both so much for joining us. Minister Fala, I wanted to begin with you. Where is South Africa on its TB goals, and what kinds of interventions have you seen successfully reduce the incidence of TB? And on the flip side, are there any failed interventions that you've learned from?
Well, let me start by acknowledging that we have made a lot of progress right until the advent of the COVID pandemic. Still not enough in terms of reaching out, making sure that we can screen enough people, be able to have a full picture of the prevalence, do enough testing. But working together with our health professionals, civil society, we put the structures under the South African National AIDS Council, which also looks at TB and sexually transmitted infections. And over the last 2.5 years, most of that was derailed, especially during the hard lockdown. So we lost quite a lot. I must say, we acknowledge that even before that, in terms of, as I've said, we're not yet at the right targets in terms of reaching, making sure that along the 90, that 90% of people, who may have TB know their status and are on treatment and and can be cured. We're still having a lot of drug-resistant TB also growing, but the pandemic actually clearly pushed us backwards. But once the level of the pandemic went down, we have reorganized ourselves, got back together, and we quite recently approved our recovery plan. And just 6 days ago, last week, from Tuesday to Friday, we had a national conference where all partners were recommitting to their roles from the government side, making sure that we can avail the necessary resources, financial, as Lucica has indicated. We fund up to 72% of our TB response from our domestic resources. We made from the government side making those commitments. The professionals, the scientists were there to up the research. The communities organizations were there also to help us, to go out and do further screening and put people on be able to avail the modern available tools. And part of what we said was that TB and HIV lost to COVID, but COVID gained from some of the work which we had already done. We used all that experience, and we said now is the time for COVID to pay back to TB, because we must use all the energy of fighting COVID now to fight against the TB.
Thank you. Minister Terese, so likewise, can you talk about your government's efforts to reduce TB in your nation of 115 million, including in the north, where the current conflict has hindered access to healthcare for about 6 million people?
Thank you. Yes, well, reducing TB incidence and mortality has been one of the biggest focus areas for our ministry and the government of Ethiopia. And with MDG, the 15 years, we've had a reduction of mortality of around 60%, achieving those targets by primarily focusing on access to care at the primary healthcare level from our community health workers, but primarily in decentralizing diagnostic and treatment services in the primary care system, including our hospitals. And mortality, incidence even between 2015 and 2020 has also reduced by around 34%. And we recently, in 2020, we actually were out of the MDR high burden countries by the expansion of lab drug susceptibility testing and also treatment facilities for MDR. However, the big challenge is we are still not detecting a large number of cases with TB. Just this year, we have raised from about 72% to around 81% now of case detection rate. But we're still not detecting close to 20% of those affected by TB, and that's a large number. So to really improve that, we have been also focusing on different approaches, of course, but particularly enhancing community-based detection by empowering the community health workers to detect cases, but of course link them with a different level of cares to be tested and treated. But that has been one of the big challenges still that we are facing.
And now, just to follow up, because Minister Fala had brought it up, how has COVID and then, of course, the conflict that's happening, how has all of that combined over the last several years impacted your efforts?
Yes, the pandemic and also the areas affected by communities, areas affected by conflict have been most affected by in different health issues, of course, and one being TB. Of course, within the pandemic response, and after a few months, we actually established another task force that in parallel works on continuity of essential services while we respond to the pandemic. So there was an active engagement of ensuring that, for example, patients like TB and HIV, they are not lost to follow up, and there's phone consultations, phone follow up to make sure that they're coming back to care, and also taking multi-month dispensing. So those interventions have helped us reduce the disruptions, and also particularly in conflict-affected areas, we were sending mobile health teams. And also for displaced populations, temporary clinic establishment, and ensuring medical supplies, TB drugs, HIV drugs are sent to areas where government cannot access, using our development partners and humanitarian response partners. So those combination of these activities have helped us reduce the disruption, but at the same time, there are also interventions that within the pandemic, although it has been a challenge, it was an opportunity. For example, now we are expanding molecular testing, rapid molecular testing with gene experts, but not just the expansion of the diagnostic facility, but ensuring that it's also connected through technology. Digitization is one key aspect of COVID pandemic that is really pushing things forward. So recently we have connected we have around 324 facilities which have gene experts. So now we have connected them with this new software which enables optimization of care, and the results being sent to patients, sent to physicians and or other care levels of care providers, enhancing the utilization. So it's not just having the diagnostic, but how we use it. So we're seeing those having a better impact in the way forward.
Thank you. Mr. Follett, so South Africa and many nations have benefited greatly from PEPFAR, from the Global Fund. At the same time, as you've seen, the pandemic has exposed the dangers on relying on wealthier nations for vaccine supply. So this, of course, gets to the growing focus and development on localization and self-sufficiency. What are your thoughts on this localization push, and what local efforts have you seen increase in your country in the fight against TB?
Indeed, we've learned a lot during as a result of COVID. Some of the still relevant, personal protective equipment. We struggled in the beginning of COVID, and remember, in terms of infection prevention and control, those are still relevant. So following that, just as an example, there's been a huge ramp up of local production of quite a number of companies now are producing the PPEs locally. From diagnostics, we're still far short in terms of locally produced diagnostics. There are a number of companies, PCR, there's one of the local companies based in Cape Town, which has produced a PCR test which is fully accredited, which is functioning. So there's progress in that regard. In as far as therapies is concerned, we're still a little bit short. We do have companies which are producing a number of therapeutic, drugs. Unfortunately, a lot of them still depend on active pharmaceutical ingredients, which are imported. But at least, I'm sure many of you would know one of the big companies which has become global called Aspen Pharmaceuticals, which is producing quite a number. But of course, as I said, both in terms of HIV and TB, there's still a lot of dependence on imported active pharmaceutical ingredients. In the area of vaccinations, of course, as I said, in the conference, a number of our scientists are working very hard together with their global partners, looking at the wide variety of progress which is being made. Hopefully, again inspired by the rapid production of COVID vaccines. That if COVID could do it, why can't TB do it? To produce a vaccine within rapid period. And of course, the messenger RNA technology is also giving us a lot of hope. And as you know, that we're very grateful for the collaboration with the WHO in establishing an mRNA hub in our country, and there's a lot of optimism that through that we could be able to speed up the production of better therapies, shorter regimens of TB treatment, and also including vaccination. So across the board, there's a lot of push to say we can't continue to depend on the developed north from the south as well. We must build our capacity across all the various intervention strategies.
Okay. And now, Minister, today's is similar. What localization efforts have you seen in Ethiopia? And what are your thoughts on this, general localization rhetoric? Do you think it's been translated into action?
Well, in terms of we're talking about local solutions, not the financing aspect. So no, I think it's not enough, is not yet done to really bring context-based solutions, and that's an area where we need to do more, because in some of the country contexts, types of diagnostics that are needed need to be really context specific. We have tried some. For example, we have a lot of pastoralist communities who are mobile. So mobile TB clinics is something we are trying in few areas. We have yet to see the outcomes, but also, as I mentioned earlier, really how best to use community-based detection is one thing, and also expanding the different technologies. But also the access to drugs, it's really highly dependent on how timely we get them from the different countries that are imported, which should be now expanded globally. And there's always a procurement process for TB drugs is always a big challenge for us. So I think these are areas where probably big investments on health system strengthening need to support on the way forward, especially with investments through Global Fund and others, to ensure that countries have this health security aspect that cannot be disrupted with different challenges.
Now, quickly, just to wrap up, a twofold question. What are your thoughts on the Global Fund replenishment that happened yesterday? And what would be one call to action you would like to see after UNGA wraps up?
Well, we're very hopeful about yesterday. I know that the target was $18 billion. If I'm not mistaken, the end they said it was 14.2 billion. But it looks like there's still hopefully some big hitters who must still come to the party. We hope that even if it's not immediately reach the 18 billion, but very close to it. We, as a country, I'm sure all of us as the African region and other developing countries, we're very grateful for these contributions, because they make a lot of difference in terms of our abilities, especially now. I mean, we're all worried that with this ambition, with all the challenges in the world, with the conflicts and diversion of resources to other priorities for developed countries, that this may not happen. But we are pleased that many countries still came to the party. What we're looking forward is a continued commitment, because this is not a sprint. It's a marathon. We know we have a target of 8 years to stop TB, and also on the HIV side as a public health threat. It's good that we've given ourselves such a short period so that we can push, and hopefully we will maintain this momentum over this next 8 years, and make sure that also in that period is not just the financial resources, but also that the util, because what is important also is to allow countries the space to develop their own capacities with the assistance of this injection of this financial resources across what we have spoken about, creating internal capacity in terms of technical, professional skills, research, scientific skills, production. Because if this funding can contribute towards that, then it means actually beyond the 8 years, many of us will be self-sustaining. not only can we have more certainty in terms of, the defeat of these epidemics and pandemics, but also self-sustainability if we are allowed to also build our own capacity using this financial injection.